Hello and welcome back to the Advancing Healthcare Innovation Show. I am your host, Michael Stamatinos, and if you're new to us, welcome. It's great to have you here. We're just really excited about a lot of things, but we're having some really fantastic conversations with real leaders that are painstakingly reshaping the future of care and healthcare. And we're passionate about a few different areas. We're very passionate about healthcare innovation, leadership, access, and honestly the adoption of those innovations. So if it's your first time tuning in, let me just take a quick step back here and just kind of give you the lowdown of what we're really trying to get done here. So we're focused on bringing real stories of innovation and leadership to life, not just the stuff that you read, but real people that are really innovating and getting stuff done. And not only just sharing the wins, also sharing some of those learnings and some of those vulnerable moments. And our highlight, we want to give those folks the opportunity to share their story with our community and ultimately with the world. And if you haven't checked out any historical interviews, wherever you are now, if you're watching this, if you're listening to this, please hit the subscribe button now so that any new interviews come directly to you. Really excited about today's guest. But before I kind of dive in, every night in this country, in the US, a child is placed with a new family, a new home, new school, new rules. And almost always, no medical records, no doctor, no continuity of care, just a kid, a family trying their best, and a healthcare system that, was really never really designed to follow them. And most people in healthcare, they actually don't really know about this. So this is a conversation that is very near and dear to me because my mother-in-law is actually really involved in this, and we'll talk about that in just a moment. But this huge gap exists, and today's guest decided to close it. So Michelle Turner is the founder and CEO of Here Now Health, the first virtual healthcare company built exclusively for children and families impacted by the child welfare system. So before she was CEO, she was a foster parent to more than 40 children, like 40 children. She also served as a court appointed special advocate. She ran an FQHC. She led a global telehealth nonprofit, like rock star. She's seen healthcare from the clinical side, the operational side, and even the sort of kitchen at midnight side when a child in your care is sick and the only answer uh, anyone is offering is the emergency room. So that is the moment that Here for Now Health was built for. We get to geek out on a lot of different things today, but trauma-informed virtual care is something that is needed. Continuity across placements is needed. Um, they have been purpose-built for a population that's been invisible to most of healthcare for far too long. And today we get to shine a light on someone that is doing something that is very noteworthy. So, Michelle, awesome to see you. Welcome to the show.
Thank you, Michael. I'm so excited to be here. Thanks for having me. And thanks for that incredible introduction.
Well, it's a pleasure. It is being recorded, so now you get to have it. So when people want to know who you are, you just pop in the recording and you're
I
like,
will.
"Here's who I am."
I'll stop giving
Yeah,
my own introduction. I'll
or
just
you
use
just
this
have me
recording.
MC. I'll just MC
Yeah.
for you, and every time you go somewhere, we'll do that.
All my calls. Yep.
All right. So before we talk about Here Now Health, which is important, I wanna go somewhere first. Um, you have fostered more than 40 children. 40. Most people hear that number, and I just don't think that they can compute it. So I want to start there. When the first child came through your door, what was that moment actually like?
That's a really good question. My husband and I became foster parents in the state of Georgia in 2013. We had two biological children at the time, and we actually started our fostering journey with a very kind of limited idea of what it was going to look like. And that for us started with we
Right.
thought we were going to adopt 1 to 2 children,
Hmm.
and we didn't think we could be foster parents. We thought it would be too hard. All of the things that you hear why people don't become foster parents, we kind
Right.
of believed at the beginning.
Hmm.
And we went through the process, we got certified, and our home
Hmm.
sat open for about a month and a half. And this is a time, just to set the stage for you, this is a time when Georgia's foster care system was in crisis. We had
Mm.
18 foster families in our county and
Hmm.
110 foster children. So if you do that
Wow.
math, that is not
Wow.
enough
Yeah.
homes. And here we were with 2 open bedrooms, waiting, thinking we are only going to take children that are adoptable because it would be too hard to love children and let them go.
Hmm.
Um, so we waited for about a month and a half and realized how ridiculous this was. And my
Hmm.
husband and I had a conversation. We said, "All right, we'll give it a try." So I called our caseworker and I said, we want to be open to respite care. So respite care is essentially temporary care. We thought we could
Hmm.
probably do that, right?
Right.
So the very first placement, the very first child that came into our home was a 7-year-old boy who
Hmm.
came for 1 week because his foster family was going out of state and he couldn't go with them.
Right.
And we got through that week, Michael. He went back to his long-term foster family, and I immediately called my caseworker. It's like, send us whoever you have. This is just he was a 7-year-old boy. He could have been the kid sitting next to our daughter in elementary
Yeah.
school. And
Yeah.
it just gives you that stroke of reality of
Yeah.
what are we doing worrying about our own feelings more than the children in our county who we know don't have a bed to sleep in at night.
Hmm.
And that essentially, as they say, like open the floodgates. And over about 5 years, we had over 40 children in our home. Some stayed for 2 nights. 4 of them stayed forever. 4 of our 6 children are adopted out of foster care. 3 are biological siblings. We had everybody from itty bitty babies to 17-year-olds who were about to age out of the system. One teen that came to us with an ankle monitor. I mean, like the whole gamut, and a probation
Mm.
officer. And it really shaped the reality, as you mentioned, of Here Now Health, which is over 5 years recognizing that even though I was working in the healthcare system every day, I failed over and
Mm.
over again to get kids the mental health care they needed, even though I was probably the best suited out of anyone to get that care to them. And I knew we had to do
Yeah.
something about it.
When you saw these gaps, these lapses, I'm just because you've seen this from the inside. I mean, what was your initial feeling like? Were you angry?
I was angry and I was confused, honestly, Michael, because I had this idea, which a lot of people do, is
Yeah.
that if a state decides they can be a better parent than a child's parents, and
Mm.
by that meaning they take them into custody, and essentially when that happens, it means the state becomes
Mm.
the child's parent, that they're actually going to do it, that they're going to make sure they have the resources, the tools, that the adults they put in charge of these children have everything they need to make this child's life better. And
Mm.
what I found that a lot of people already know is just because a child comes into state custody does not mean that their needs are now being met.
Mm.
We have a much higher level of accountability, and we should be providing those needs. But oftentimes, if not most of the time, that child is just in a new home and their needs are continuing to not be met. And so it did. It made me frustrated. It made me angry. And it also made me feel like I was letting down the kids, that I was
Mm.
not doing my job properly, even though I knew that there was almost no way to do it. In the county that we were in Northwest Georgia, we
Right.
had less than a handful of therapists that accepted Medicaid, most of which did not understand the child welfare system or had wait lists of 6 months or longer. I
Hmm.
knew I knew that reality, and that again is really the basis for why Here Now Health now exists, because it's what I needed, it's what we needed.
Mm. I have spent a long time talking with innovators, talking with founders, and there's something that makes a founder, I'll just say, unreasonable. not reckless, unreasonable. Founders that who build something real, are ones who like you can't not do it. That's you.
It is. I've anyone who's known me over the last decade
Yeah,
has probably heard this story. For a very long time, I tried to get other people to build it. I just knew the world needed it. This was not, Here Now Health doesn't exist because Michelle Turner wanted to be a CEO or a founder. I would talk to almost anybody who would listen about how
yeah,
this
yeah,
was not only needed, but it actually made sense. It's a population that's 100% covered by Medicaid. We have all these structures in states where it allows us to actually scale
yeah,
healthcare for this
yeah.
population. And kind of nobody was doing it. Nobody was innovating. And so,
Yeah, I mean, because you had a career. I mean, you had a life. You could have easily just kept going.
yeah,
Just, I'm just like, what made you feel like you couldn't leave this problem for somebody else?
I I spent almost 6 years helping to build a company called Hazel Health, which is the largest provider of school-based telemedicine. And it gave me the startup chops. It gave me the understanding of the healthcare system at a macro level that I didn't understand when we were
Hmm.
foster parents and when
Yeah,
this
yeah,
idea was
yeah.
just starting. And it really gave me the tools I needed to launch Here Now Health. And so when I left Hazel, on very good terms, and my colleagues and my leaders at Hazel were honestly some of my biggest champions. It was kind of like you said, because I had talked about this so much, and I knew if it it was already too late. But this should have existed years ago.
Yeah.
And I'm one of the few people that deeply understands not only pediatric Medicaid, but also the child welfare system and how they fit together and don't fit together. Um, but
Okay.
those are, that's really the crossover that was needed, and not a lot of
S-
people in this country understand it.
So walk me through the exact moment that you decided to build Here Now. Not the idea, because that it sounds like that had been simmering for some
Yeah.
time. Like the decision. Where were you? And like what happened?
So it's an interesting story. I was my first funder is HealthWorks Studio out of DC.
Okay.
And I accidentally pitched them. I 2 summers ago got in contact with their team about a completely different uh, reason, one of their other portfolio companies. I talked to them about it, and we got to the end of the call, and they said, "Well, you seem to know a lot about Medicaid, and we're looking to launch a few companies in the next year in the Medicaid space. Where do you see white space? Like, if you were going to
Mm.
build in the Medicaid area, like what would you build?" Which is like catnip for me because I was like, again, anybody
Like,
that gave me an open door
sure.
is what I would talk about. And this was not a setup. They were genuinely asking.
Yeah,
So
yeah.
in the last less than 5 minutes of that call, I kind of accidentally pitched them on what is now Here Now Health. I said, if I was building a Medicaid, 100% I would do it for the foster population. We spend 10x on the behavioral health spend for this population. They're 100% covered by Medicaid. And, in X number of states, they're covered by one health plan, and those health plans are looking for innovation because this population's been. I did my spiel, and I thought I would never talk to them again. Like this was
Right,
just, hey,
right.
take this idea and run with it. They thought it was really interesting, and so they called me back up and they said, "Will you come actually teach our team about child welfare? We want to know more." So I met with their broader team for an hour and just shared my heart and my knowledge. Again, full well giving them this as, hey, you can take this and run with it.
Yeah,
And they decided this is not just a huge need and a great mission, but kind of like I'd been sharing, there's really interesting business drivers behind this population. This could create a great company. And so they did diligence over the next several weeks to months. I kind of supported by being the subject matter expert in that.
yeah, yeah.
And um, a year ago this past fall, they called me up and they said, we want to invest in this area. If you will come lead this company, we will be the first check. And that is when that decision was made.
I
And
just
I
got
kind of
goosebumps.
accidentally raised my first investment check.
Wow. Yeah, so I mean, you just knew so much about the problem. You illustrated it so clearly that naturally they're like, well, if this subject matter expert knows so much about this problem, she's going to figure out the answer. It's just a matter of, funding and who, like who else are you going to talk to? Because you mentioned about just the complexities of it. I mean, because Medicaid is notoriously hard to build a business on.
It is. But when you drill down to what Medicaid managed health plans care about,
Yeah.
where they spend a lot of money for terrible outcomes, and then some other interesting things with this population around something called sole source plans. So I know you're in Chicago. Illinois
Yeah.
actually has one where
Okay.
the state actually has one health plan that primarily covers any child that has a foster care connection. Because going back, the children in foster care, those adopted out of foster care until they're 18, and youth who age out of foster care until 26, they are guaranteed Medicaid. It is not based on their parents' income. It is not based on
Hmm.
work requirements. It is because of their connection to the foster care system. Again,
Right.
the state is saying they can be their parents. And so it's
Hmm.
it's like the state is essentially giving them health insurance as their parents. And so a lot of this is really built around that concept of we can take your highest cost population, finally prioritize them with high quality care in the way they
Hmm.
almost never get, but we know they need.
Right. Right.
And instead of overspending on terrible areas like the emergency room, hospitalizations, and residential care, which is where kids end up, oftentimes because they don't get the care when they need it most and they end up in crisis, we can we can shift that spending to lower cost, higher quality early services. We will get these kids in care within 48 hours. We will keep them in care because our care model is built around their realities and will
Right.
help you save dollars and improve your outcomes. That is what Medicaid managed care companies care about. And that's what
Right.
drives them. So I had this thesis that yes, Medicaid at large is hard to build the business model around. But if you
Right.
do it right for the highest cost, hardest to engage population, we can build a great business and we can also finally do right by these families.
Okay. I want to kind of contextualize this. Let's just say, for example, waving a magic wand. I am a foster care parent. Okay. I want you to paint the picture for me. So, I get a kiddo.
Yep.
I get him on a Friday night. No records, no history, no established doctor. What happens next, with Here Now Health in the picture?
Yeah, so the child comes into care. They get placed most likely with an unknown, foster family, and they may have no idea what diagnoses they have, what triggers they have, and so we have an intake form, a referral form, essentially that takes less than 3 minutes. We don't
Hmm.
require it. We know they're covered by Medicaid. Most of the time, that foster family is not going to get a Medicaid card. They may never get it, but they're definitely not going to have it by Monday morning.
Right.
That child really needs to be seen. And so we will take whatever information they have. Maybe they've got two forms and they've got two different birth dates. They're not sure which one is correct. We'll take both of them. So we have that intake form submitted. Maybe it's by the caseworker, maybe it's by the foster family. We schedule an intake within 48 hours with a therapist who understands child welfare. They
Hmm.
understand not to ask that child, when do you get to go home? Or
Right.
who are your real
Right.
siblings? Are they living with you? These are real questions I've heard from therapists. And so every one of our therapists at Here Now is not only experienced with professional and lived experience, but they also have training from us to be able to handle these difficult situations appropriately.
Right.
And we have that intake with the child and their new caregiver within 48 hours. And we start to build trust. And we also start to guide that caregiver and how to stabilize this, brand new child in their home's reality.
Right.
Um,
Like, how
and we
often do you
build
interact with them? Is it like multiple times a week? Is it? Is
Yep.
there like an urgent care hotline that they can call? Like I can only imagine some of these things pop up.
Right, right. So we are it's based on acuity and need. And
Right.
so we average seeing each child and their caregiver 1 to 2 times a week. As kids
Yeah.
stabilize, sometimes that need becomes every other week, and that's fine with us. We want to be as present as needed.
Yeah.
We have several youth who are seen 2 to 3 times a week themselves, and their caregivers being seen by the same therapist. It's one of the unique things
Hmm.
about our model is we built in caregiver support. We know that that is the number one factor of stability for kids within the child welfare system. Is
Consistency.
is the consistency and the stress level of their caregiver. Because if you think about it,
Mm.
Michael, kids don't make the decision to disrupt their placement. Not usually. It's the
Yeah.
it's the adults. And you
Right.
do that when your stress gets to a level that you don't feel like you can manage it anymore. Maybe it's because, the middle schooler who was just brought to you a month ago comes home from school every single day and destroys their room. Maybe it's because bedtimes are so horrifically difficult that you and your spouse are not getting sleep and you don't know how to manage a child who screams for 4 hours every night. You don't know what you're doing wrong. If you don't change the reality for that caregiver, they're going to disrupt. And what that means is they call up their caseworker and they say, I can't do this anymore. Find them a new place to live. And that is when
Mm.
the outcomes decline rapidly for that child. Every single time they move, they lose most of their life. They lose their providers, they lose their schools, they lose their teachers, they lose their mentors. Lots of times they actually lose their caseworker if they're moved, outside the county and they have to
Wow.
start fresh. So think about as an adult how hard that would be. Now imagine you're a 12-year-old.
It's just
I mean,
trauma after trauma after
it's trauma
trauma.
after trauma. Yes. And and we wonder why that is the first indicator of a child's, outcomes declining is that move because they lose every bit of themselves. And so, what we really want to do is we support the caregiver so that doesn't happen. And
Yeah.
if it does have to happen, we stay with that child to be that transition and that continuity. And so the youth doesn't lose their trusted provider even if they do move, planned or unplanned.
Mm. So you stick with them.
We do. We do. We continue that therapy. We continue
Is
that
that is
care.
that hard to be able to stick with them, knowing that they're moving? I mean, do they? Because it just seems like there's a lot of drop-off points that can happen
Yeah.
because
And
they go to a new foster parent. That new foster parent doesn't know anything about the older foster parent. Is there like a system of record where all of this stuff is kept, and are you guys that system of record?
So we aren't the system of record, and the system of record is ever changing and unfortunately oftentimes flawed. But what we do is we make human connections with every single person we possibly can. The care
Mm.
manager at the health plan, the caseworker in the foster system. We engage biological parents even if the child's not placed with them.
Hmm.
Um, and we fight to stay with that child. We do the things that other behavioral health companies just aren't built to do. So I'm going to give you
Mm.
an example. We were sent a referral a few weeks ago for a child who was in a foster placement here in Virginia.
Okay.
And um, before we even did their intake, they were moved to a kinship placement. That's kinship is a family placement. So in this case, I believe it was the child's aunt. Well, when we got on to our therapist got on to do the intake, they realized that that kinship placement was actually in West Virginia. So the
Mm.
child left the state. And our therapist was not actually licensed in West Virginia, but we knew how important it was that this child have therapy start as quickly as possible to make this placement successful. So
Right.
in 24 hours, our clinical team contacted the Board of Social Works in West Virginia, insisted that our therapist get a license in West Virginia because of how important it was that this child have continuity care during that move.
Wow.
We found a very sensitive person in the social work board who believed in what we were doing and understood the importance of that continuity for kids in the foster system. We got a West Virginia license, and within 24 hours, we started seeing that child and their new caregiver again. And
That's
again,
innovation. That is amazing.
it's what should be done. It's doing what should be done to make sure kids would get what they need when they need it most. And that's what we're
Hmm.
built to do.
Wow. I want to ask you a question that
Yeah.
maybe most don't ask. Because you fostered more than 40 kiddos, you're building a company. I think most people would pick one of those things as their life's mission, and you're you're doing both. How did those two versions of Michelle like talk to each other? Does the foster parent make you a better CEO, or does the CEO make it harder to be present as a parent?
Depending on the day, depending on the hour,
Yeah.
I believe being a mom makes me a better CEO. It makes me a better founder. I believe very strongly it makes me better at every aspect of my life. I've learned more from my children, both my forever children and my former foster children, than
Mm,
I ever learned in school and a graduate program and previous roles. It hands down makes me better at building this company. And I also believe it makes me better at prioritizing my time. I do
mm,
not have the flexibilities that some
yeah.
founders have. My kids will always come first, but they come first in a manner that actually makes me, again, I believe, a better leader and a better CEO and more thoughtful colleague, to my staff.
Yeah.
And I believe very, very strongly in that.
Mm,
I still take stories from the youth that were in our home and let them guide what we are building. Uh, and I'll give you an example. We had a teen
please.
foster daughter, yeah, a teen foster daughter in our home. And I remember sitting with her, going over the plan. We had had a meeting that day while she was in school with her caseworker, and she'd given me some things that were on her case plan that she needed to do, and a timeline for the goals for when she was going to be going back home. And I was going over this with her, and I remember her staring kind of blankly at the page. And I got done, and I was like, "Okay, so what do you think?" And she looked at me and she said, no one ever asked me what I think about this. Nobody ever asked me what I think should be in my case plan. And this is
Mm,
a 15-year-old girl who had, goals and ideas of what she wanted to do post high school. She was smart enough and intelligent enough and mature enough to contribute to what was needed for her, what safety looked like for her to return home, and nobody was
yeah.
asking her. And and it's just one example of what I've taken into building here now of we center the voices of those who have been impacted by the system most.
Mm,
The number one voice we listen to are kids and families that have been most harmed by the foster care system. We want to
mm,
build what they want to interact with, what they want to engage with, and what would support them first and foremost. And we
mm,
believe by doing that, we're not just building the type of company that I want to be proud to lead, but we're building what will naturally be engaged with and
mm.
therefore will help us meet the health plan goals and the foster system goals.
Yeah.
And so yeah, I know it's kind of a long-winded way to answer that question, but I try to take every story, every interaction that I've had with our, children and the families in the foster system that I honestly was honored enough to have a part in,
Yeah.
and I use it every day.
Yeah. It's a very real way of answering the question and like grounding it in, hey, like, these kiddos are basically sharing their soul with me. And the one thing that we can provide to these kiddos that costs nothing is like giving them dignity. And like you said,
Absolutely.
asking them what they think about it and asking them for feedback. Interesting that no one had ever asked her that before. That's like pretty fascinating to me. Why do you think that is? Like, why has healthcare been so willing to, I don't know, like look the other way around, on this group? Like, it's a very niche problem. It's a pervasive, it's a big problem, but you don't really hear about too much.
Because she didn't have an MSW or an MBA. She did
Mm,
she didn't have a title that allowed her to decide what a case plan should look like. Um, and I think we get that wrong a lot in healthcare. Decisions are made by those who oftentimes don't need the care themselves.
right.
And then we are, we act so confused when whatever we build doesn't work. You hear oftentimes that there are populations that are hard to engage, right?
Yeah.
And kids and families in the care system are high on that list. They don't want to engage in healthcare, is what we hear all the time. And I believe that is 100% false. We
Mm.
have built systems that don't make a large percentage of the population feel safe. We have built healthcare systems that don't actually work in the lives of the kids and families who need them most. And then we blame them for not engaging in these systems. I mean, if you think about it,
You're
if
basically shaming them for not.
exactly.
And then what do? They hide further. They don't
Yeah,
engage even furthermore.
exactly. And so if you build something that is wanted and needed, and you build it alongside or with them as the leaders making the decisions, this is what
Yeah.
we want, this is what we need, they naturally engage. And that is what we're seeing. 90% of our referrals we turn into care. That is an incredible number for any Medicaid population.
What's I guess what would be acceptable? You said 90%, which is amazing, but
Yeah.
what's typical?
In typical Medicaid, it's usually around 50 to 60%. And that's not accounting for the fact that we are actually serving the hardest, again, quote unquote, hardest to
Hmm.
engage population within Medicaid. There's not really clear numbers, but we know it's definitely sub 50%. And we are getting 90% into care simply because oftentimes our therapists do, they call our aged out youth before their appointment and tell them they're so excited to meet them. We don't require any login for our virtual sessions. Every single thing we do is done by SMS text. We meet families where they are and with what they're using most.
Yeah.
Logins are actually a huge barrier. You think about that. If a child's had three caregivers in the last month, do you think they passed on their EMR login to the next
Yeah.
caregiver?
No, of course. Yeah.
No, of course not. And we face this all the time. I could never get into a child's, their EMR for their pediatrician or whatnot because the login was lost three placements ago. So we made that very, very, clear decision early on. Everything we do is done without a login.
Hmm.
And it's hard. Technically, it's hard, but it's worth it.
Yeah. And I'm just thinking, so if you could sit across from a managed care executive right now and someone who controls billions in Medicaid spend,
Mhm.
and you had 60 seconds to tell them what they're missing, what what do you say?
I would let them know that the thing that they are spending the most on is causing the most harm, and we can fix it. Because that's two things in one. One,
Mm.
we're spending money that doesn't need to be spent,
Hmm.
and you're doing it in a way that doesn't just harm your members, it harms your business.
Yeah.
And we can do it better. We're we're not curing cancer here. We are taking innovation that already exists and we're placing it in the area that needs it most with families
Yeah.
who need it and want it. And so let us help you. Um, and we're going to do it in a way that actually makes life better for our families and kids who need it most. And so I've had this conversation with, multiple health plan leaders.
How do they react?
And what's that?
How do they react?
The ones who understand the problem most are immediately interested. They know they're
Mm.
overspending on really bad care. They have to, right? Because of the level of accountability for these kids, they can't say no to care. And because community-based providers typically have really long wait lists and other behavioral health companies will never prioritize these kids, they're stuck paying for emergency room visits, kids sitting in the hospital beds when they shouldn't be, and ultimately residential care because all of the adults in a child's life have given up on them and it's the only bed for them to sleep in. And they have to have a bed for them to sleep in. And
Mm.
so the ones who really understand the problem are immediately interested. I remember early on in my journey as a founder, I was in front of a health plan and, again, sharing this. And I remember she said, we're so tired of our kids being an add-on. That's what we don't want. We have behavioral health companies come to us and say, we'll serve those kids too. And what they mean by that is we'll throw them at the back of the line and we'll give them the
Right,
exact
right. Yeah,
that we're giving
yeah,
everybody else,
yeah,
right?
yeah. Right.
And they're tired of it. They know that these kids deserve and need different um, and the very best care, but nobody's willing to prioritize them. And so I let them know more than anything, we are prioritizing only kids and young adults impacted by the foster care system because they deserve it more than anybody else. And we
Yeah.
want to fight this with you. We want to be your partner. We don't want to be a vendor. We want to be your healthcare partner for the child welfare system. And the ones who really understand it are immediately engaged and interested.
Yeah, you're in their top five favorite people of all time. How do you how can people I mean before I forget, I mean how can people follow, what you guys are doing? Give us like a commercial so that people can go to like a website, something just so that we have it here and that they can,
Yeah,
engage with you further.
I'd love to chat further, especially with health plans, as we are Medicaid funded first and foremost. We want to, we believe healthcare dollars should be paying for healthcare services. Um, I'm pretty active on LinkedIn. It's a great place to, follow along. Michelle at herenow.health is my email. I would absolutely love to talk through, where your needs are, where your gaps are, and how we can partner to help fix those. We
Hmm.
are we are live in the state of Virginia and Missouri in partnership with the Medicaid health plans in those states, Anthem Health Keepers here in Virginia, Home State Health, Show Me Healthy Hit Kids in Missouri. Those are the plans that cover foster connected lives.
Hmm.
We'll soon be announcing another state in the next month or so. But our
Very
plan is
exciting.
to launch into 3 to 4 more states in 2026. We know it's needed, and we'd love to chat through how we can partner with your state
Mm.
on helping to meet these needs.
That's amazing. I know we're kind of wrapping up, but I've just in my mind, I'm just kind of percolating just the last question because you're building something that has never existed before. It's so exciting. At the same time, it's also terrifying. And it takes a certain type of leader and leadership to be able to kind of guide your team through that. And I know you're really in it right now, but if you had to like peek out 10 years from now, and I know we're just guessing right now, we're just guessing, and it's 2036. And I'm hoping this happens like a lot. If Here Now Health worked, and I mean like really worked, what changed for these kiddos? And what does that world look like that you've built toward?
If we look that far in the future and we've been successful, um, it is never a question that healthcare access would keep families apart. Number one.
Mhm.
Um, believe very, very strongly that healthcare, the lack of healthcare should never be a reason we rip a family apart or we take a child into the foster care system or keep a child in the foster care system. And number two, every stakeholder in the country, caseworkers, court staff, CASA volunteers, know that if a child within the foster care system needs help, we are the ones they can turn to get that
Yeah,
help quickly and appropriately and support the whole unit of that child.
yeah,
And I think those are I would say those are the two main things if we've been successful. That is what we're building to be. We are not just building to provide therapy. We are building to be the healthcare partner for the child welfare system. We want to do this hand in hand with them, and we want to do it better than anybody else has ever done. And so that would really be my goal.
yeah. Throughout this whole conversation, the one thing that and you've, by the way, just your whole story, all the different, and I know you've got sort of your husband's in the military, so uh, tours of duty. You've done these really unique tours of duty that have prepared you for this, and while also being a foster parent, and just the two words that continue to come up in my mind throughout this whole conversation were consistency and stability. And it's like, hey, if you want to build a kiddo that's going to have like a real good foundational life, you need to be consistent, you need to be stable, and you need to build systems that embody those two things throughout their entire like journey. So I'm just grateful that you joined today, given that you're a mom, busy CEO, and you were super intentional and just very rigorously honest about just your answers. So thank you for that
Absolutely.
and sharing the journey with us. And I'm excited for you at some point in the future. We always keep the door open for guests to come back and share more about what's going on in these next few chapters. But for those that are, if you tuned in and if you found this conversation to be particularly helpful, revealed anything, please, the best way to be able to support would be to either comment, share it, even reaching out to Michelle directly, that would be really, really meaningful. And if there is a topic that you want us to explore further, or even a leader that you'd like to hear from, drop us a note, leave a comment. We do read them. For me, this is a platform that it's not just about content, it's not just about like real conversations. It's actually about community. It's a living, breathing ecosystem. And if you want to eat from it, you have to feed it. And that is our way of feeding it. So drop those comments. So thanks for listening. Keep building with purpose, and we'll see you next time on the Advancing Healthcare Innovation Show.